This is Altura Now with Nicola Burton.
As the COVID-19 situation evolves, Altura aims to keep you up to date with the latest information, and today, Sean Rooney, CEO of Leading Age Services Australia, joins me from Canberra to talk about actions in the home care and retirement living sectors. Sean, thanks for joining us.
It's great to be here, Nicola.
Sean, borders are closed, travel's restricted, and many people are now self-isolating. How critical is this for the protection of older Australians, especially in aged care?
Look, it's an issue of national importance that we protect vulnerable older Australians from the COVID-19 virus. As the Prime Minister said, the national priority here is to slow the spread of the virus because slowing the spread will save lives. And that is core business for the aged services sector as we deal to protect as best we can older Australians receiving care, either in residential care facilities or in their own homes, whilst also protecting the passionate and professional workforce that cares for them.
Now, what are the specific challenges for home care and retirement living sectors?
Yeah, unlike residential aged care where we can restrict visitations, where we have a very stringent infection control within the facilities that are operated, it's a lot more difficult to be able to bring that level of, control and restriction to people's own homes, be they in the wider community or in retirement villages. And we know that around 1 million older Australians receive care in their homes through many different forms of care, through different government programs, and around 200,000 older Australians are residents in retirement villages. And so ensuring that the workforce that's supporting those older Australians, but also the wider community who's engaging with those older Australians, is observing all the guidance with respect to social distancing and all the other measures that would restrict the infection of COVID-19 is fundamentally important.
Can you talk us through the measures that apply generally to home care?
Yes, so home care providers need to ensure that their staff are adequately trained with regards to good infection control, including the use of personal protective equipment where that's warranted. We shouldn't have any staff attending work if they have travelled overseas, if they have any symptoms, or if they've been in contact with anyone who's recently travelled overseas, or indeed if they have any of the symptoms. And we know that all the other social distancing guidance applies for both for staff, but also for the older Australians that they're looking after. And having good communication between the operator, their staff, and their clients is fundamental to getting this right.
And other measures such as social distancing, we're making sure that people in home care don't go to perhaps day centres and those types of activities anymore?
That's right. I mean, as I said, the guidance for the general population needs to be adhered by everybody, but in particular older Australians and those older Australians receiving services in their homes need to be exceptionally vigilant with respect to reducing the risk, and that is observing all those social distancing measures that apply for the community.
And communication is absolutely paramount to home care, both the clients and staff and providers.
That's right. I mean, home care is a relationship business. You know, those older Australians receiving care and services like to see that same friendly, smiling face that comes in, you know, either daily or weekly to provide all range of different types of supports. So having good communication between the person giving care and the person receiving care, but also the organisation that ensures that those things happen efficiently and effectively is fundamentally important to ensuring the protection of the older person, but also the workforce.
And you work closely with industry. Do you find that home care providers have been proactive on protection?
Look, we've seen many examples of that. There was a recent example where one operator a few weeks ago contacted all 1,100 of their clients and sought to ascertain if any of them had travelled overseas recently. It was identified that 7 of those clients had travelled overseas, and so the appropriate measures were put in place with regards to self-isolation, but also workarounds to ensure that they were still receiving services. So this type of proactivity with regards to understanding the clientele, the client base, is fundamentally important for us to ensure that the risk of infection is mitigated as much as possible.
And we're seeing an example there of that proactivity rather than reacting to something. So, I mean, it's about protecting workers and the clients.
That's correct. And on the workforce side of things, we know there's a significant amount of training that's underway with regards to refresher training for good infection control for home care workers. We've also seen lots of planning with respect to how operators would respond in the event of their workforce becoming unwell, or if their clients become unwell. What are the procedures and protocols put in place in the event that those things play out?
And providers are using technology to their advantage. Can you tell us a little bit about that?
Look, providers in home care, many of them do use technology to their advantage. And I think one of the biggest issues that we deal with as a sector is the social isolation of older people in their homes out in the community. And so being able to use technology in a time of, I guess, social distancing, at a time where that social connectivity is being constrained, the ability to ensure that older Australians out in the community have good access to technology and easy to use technology so they can remain connected to their carers, connected to their families and other community services is absolutely important for their mental health and their well-being and their resilience in getting through this current situation.
Absolutely. And on the technology note, you guys have got your LASA website updating for COVID-19.
Certainly, our website, several weeks ago, we created a landing page for COVID-19 information for aged care providers. It's publicly available. It provides all the latest resources and guidance from government agencies. It has a frequently asked questions section that is updated on a 24-hour cycle that deals with all the key issues that are coming up through our membership and through our engagements with others involved in the sector. And it also has a facility where people can post questions where we can be able to respond quickly. So that's a service alongside our daily update email service that has been very well received and gratefully accepted by our members and others.
Now, we need to talk about the aged care workforce. It's under considerable pressure at the moment. What's being done to ensure continuity of care?
So workforce is critical, and as I said up front, this is not just about protecting older Australians in care, it's also protecting our workforce. They are the frontline workers who are having to deal with infection control and unfortunately in some instances infection outbreaks. So it's fundamentally important that we have supports for them right now, and I'm very pleased to be able to say that the government has acknowledged this and has come forward with significant funding packages for us to support our workforce with regards to retention of staff and also for training of staff, whilst also a number of initiatives we're working on to be able to bring additional workforce to bear in the event of an infection outbreak in the sector.
And we've had visa holders being able to work full-time hours now instead of the 20 hours.
That's right. That's one of the initiatives negotiated with government is for overseas workers on those foreign visas. Previously, they were allowed to only work up to 20 hours per week. That's now been extended, which is great because these are experienced, skilled aged care professionals that can give even more in time of need.
Can you tell us about the measures being put into place for the retirement living sector?
Look, I mean, retirement living is absolutely front and centre of our focus as well. We know that many older Australians live in retirement villages. As I understand it, the average age in some locations is around 80 plus. And so this is the absolutely vulnerable Australians that we need to protect. We've been working with our colleagues in other peak bodies across the sector and also with state governments and the federal government to produce some guidance to support retirement villages operators and also retirement village residents. And it really comes down to the simple things that you would expect. It's observing a good infection control. It's restricting visitations, being cognizant of the social distancing measures that apply across the entire community, having hygiene education and communication for residents, staff and visitors, an enhanced registration process for visitors and service providers, so we're able to track who's coming in and out of each of the villages. And the use of shared dining rooms and communal areas is being restricted now in accordance with the guidance from both state government and also the federal government. And then also minimising non-essential travel, particularly for staff between different sites. And then, of course, keeping everybody up to date. Good communication between the operator, between the staff, between the residents, and also their families and friends. So everybody is aware of the current situation. Everybody is kept up to speed with regards to changes as they occur, and they've been occurring quite quickly with regards to social distancing and other measures. And keeping that communication happening in an effective and timely fashion is absolutely fundamental to retirement villages being able to do everything they can to reduce the risk of infection.
Even though aged care is under a lot of pressure at the moment, we're still seeing our industry just stand up and still do wonderful things and offering that outstanding care that we are known for giving. So what are your thoughts? What are you seeing in the industry?
Look, I think it's been outstanding, the response that I've seen from industry. I've seen high levels of collegiality, collaboration, compassion and care, people working together across all elements of the services, all elements of the sector, with the primary focus, as I said up front, of protecting vulnerable older Australians in care and protecting the workforce. It's heartening to see that. And I would just want to assure everybody who's watching is that we're 100% behind our workforce. We've been on alert for quite some time now, as I've said. We're doing everything we possibly can to ensure the safety of older Australians, and everybody has a role to play in that.
And how we treat our elderly really says a lot about our society, and we need to do what we can to protect them.
That's right. As I said up front, that this is an issue of national importance. As the Prime Minister has said, slowing the spread of this disease will save lives, and many of those lives saved will be older Australians in residential aged care facilities. It's not just an issue for our sector, it's an issue for all Australians to make sure that they're doing everything they possibly can to stop the spread of COVID-19.
It's been a pleasure speaking with you today, Sean.
Thank you very much, Nicola.
I'm Nicola Burton for Altura Now. Thank you for joining us.